So I'll take you back to October of 2012. Hurricane Sandy had hit New York and we were out of power. We had been volunteering down at the Far Rockaways and we came home to check on the house, my then 13-year-old daughter, Serena, and I, and the lights came back on. So we were happy and excited. We were horsing around and her head ended up in my lap and she looked up at me and said, "Hey, Mom, what's that on your nose?" And I thought, I did notice that. It's such a weird place for a pimple on the rim of my nostril. Let me get that taken care of. So I called my longstanding derm, got in to see her with a little bit of delay, December 4th. She took a look and said, it's a vascular lesion, no big deal, but you need to have it cauterized. And she sent me to the Laser Skin and Surgery Center. Now, I was in the middle of launching a host of cancer drugs at the time in my role as Chief Strategy Officer of Digitas Health. And I had just lost my mother to stage 4 lung cancer. So I thought I knew a little bit about cancer. But when I interrupted my day at market research to go and have my biopsy, the physician said, it's no big deal. It's so tiny, even if it's a basal cell, really nothing to worry about. I said, I was taking my daughter on a holiday vacation for Christmas break. No worries, we'll have results for you that week. Went away, came back. It's now New Year's Eve day. And as so many of us do, it's like, let me cross this off my list. They never called. I'm sure they got busy. Maybe there was a lab holdup. And the first time my spidey sense went off was when they said, the doctor's doing a procedure. We'll have him call you right back. Well, he called me right back on the dot of 2 o'clock and he said, sit down. You have Merkel cell carcinoma. It's an extremely rare, extremely aggressive form of skin cancer. And you have a 3-dimensional problem because of where it is, so you're going to need significant plastic surgery. At the time, my daughter, because they want to know everything, had picked up the upstairs extension. So she comes down running saying, oh my God, what cancer, who, what, huh? And it was one of those moments where everyone was converging on the house. It was New Year's Eve. My boyfriend was coming and everything stopped. I called Sloan, which I had worked with deeply for many years, doing a lot of communications, and they said, we'll get back to you. And I was like, what do you mean about we'll get back to you? Well, didn't you hear rare, aggressive, fast? It turned out, I found out years later, the one Merkel cell expert at Sloan at the time, Dr. Daniel Coit, was on his sabbatical sailing the world. That's why they said, we'll get back to you. So I emailed and texted with my mother's oncologist, who became my oncologist, Dr. Abraham Chichua, who it was at NYU Langone. And God bless him, he responded to my text at 4 o'clock on New Year's Eve, and we spoke, and he said, okay, I'm sending you to Dr. Mark Persky. He was our head of head and neck for 25 years. He's now at Beth Israel, but he's more familiar with Merkel cell than anyone else. Call me back if you need anything else. I did. And then on January 2nd, I was in Dr. Persky's office. I'll never forget this. He said, I'm going to confirm the pathology, but if this is Merkel cell carcinoma, I'm bumping everybody but the babies for you. So he did, and it was. And I then had 10 days to get my life together. I sometimes remind my boss that I had to hire 3 people to do my job. And thus began what became ultimately a series of 7 surgeries. I was, at the time, there weren't any IO treatments, even in phase 1. I had reached out and have since become very familiar with all the work that Dr. Paul Neum is doing at the University of Washington. And so I did send my biopsy samples from Foundation to them to track what was then just an early pre-phase 1 research in terms of viral load and whether or not you would be a candidate for what ultimately would become the immuno-oncology treatments. So I then had a wide area excision of the left side of my nostril. I had a pedicle flap, and they took the cartilage from my ear to craft a new nose. I then had a little bit of time to heal, and I went on to a concurrent chemo and radiation protocol. Because again, here's where the lessons I've learned as an advocate really come to play. There was so little research at the time. There was one definitive study that said radiation at early stage had an impact. There was one study on adjuvant chemo, the jury was out. And so God bless my oncologist, who said, what do you think? And I said, well, at the time I was 49, I was strong and fit and healthy, and carpet bomb me was my only answer, because I wanted to live. I was a single mother and I would do whatever it took. So I was fortunate to be able to stay at Hope Lodge during my treatment. I will tell you, when they first said, oh, and by the way, you can't go home, I was like, what do you mean I can't go home? I'm a single mother. I have 2 small children, or not so small, but young enough. They couldn't be So I did. I ended up staying at Hope Lodge during the week, and I would walk down to the Beth Israel Cancer Center for radiation every day, and it was 45 minutes on the radiation table every day. I'd go back to Hope Lodge, and then I began what was supposed to be 4 rounds of chemo. It was a combination of etoposide and carboplatin, but it ended up being 3, because I started having liver involvement, and they were like, yeah, we're not going to save your life and destroy your liver. So by May timeframe, I had completed my initial surgeries and rounds of treatment, and they said, well, if you can eat, you can go back to work. And I came back to work in August, and by September, I keep saying I'm the rarest of the rarest of the rare, because Merkel cell carcinoma is so rare and so aggressive. But in the United States, 80% of patients have the underlying virus. I didn't. I then got this bizarre, then very little known condition called radiation recall. Only happens to people who have chemo and radiation at the same time. I was in the middle, I was prepping for a new business pitch when my entire face swelled up and got red. By the time I got to the ER, they were like, anaphylactic shock. I'm like, no, I don't think so. So here was my second huge lesson in what being an advocate really means. I was in the ICU for 5 days. They thought it was some infection. Finally, with all the brilliant minds of this hospital at my bedside, I was like, can you brilliant people figure this out? And I finally thought to text my photos to my radiation oncologist, who had at that time moved down to Moffitt. And he said, stop everything, get me on the phone with the head of infectious disease. I know what this is. It's radiation recall. Get her off the antibiotics and IV, get her on steroids and antihistamines. I was out of the ICU in 6 hours. So it was just such a wonderful lesson for me of, as brilliant as our physicians and the nurses are that we're relying on, that you have to speak up. And I often say to patients that I'm counseling, what you don't say is the most predictive of the care you don't get. I remember being so fortunate to connect with people at Hope Lodge when I was staying there. And if you're not familiar, I thought it was going to be kind of Spartan. It was like checking into this wonderful haven for cancer patients with all sorts of resources. Through the treatment, I developed a condition called thrush, because head and neck patients with the radiation often do that. Within a day or 2, I was like, this is like swallowing glass. This is not good. I went to my care team and said, what's going on here? And they were like, oh, that's thrush. We'll give you an, antifungal. You'll be fine. And I was. About a month later, I was chatting with one of the gentlemen at Hope Lodge, who was also head and neck, different cancer for him, had my same care team. And I offered him one of my little shakes, because my job at the time was get 2 of these shakes into you a day, right? Just to continue. And I was being IV hydrated. And he said, exactly the same symptoms. I'm like, well, did you tell your care team? And he's like, oh, I didn't think of it. And literally the next day he came back and said, thank you so much. yes, I had exactly what you had. I'm being treated already. And I thought to myself, wow, you just suffered for a month and you didn't have to. So all of that experience, I think, is what has now, as I pivoted back to both my professional role and then becoming a patient advocate, both telling my story and working directly with patients, but also now in my new role, as of January 30th, I've taken on the role of Chief Patient Officer of Publicis Health. And the fact that it exactly coincided with COVID is surreal in a way, but it feels so well timed because now I can use all of my advocacy work together with my professional experience, and now working, of course, with the Skin Cancer Foundation on everything that we've done with the Big C. How do we now pivot to, oh my goodness, we just spent the last year driving a campaign for early detection of skin cancer, and screenings have come to a screeching halt.